to express yourself without fear or favor. Whatever you're going to say here, no one can use against you and in any court of law. I therefore give you now the floor to present your submission. Thank you.
Thank you. Thank you, Chairperson of the committee. Thank you, honorables who are present here today. And really, thank you for the opportunity to add our voice to this review of the Social Cash Transfer Program. Our presentation will highlight some of the key points from the memorandum that we shared with you earlier, and we look forward to questions that you may have and being able to answer them. So with that, if I may proceed, and then I will give the floor also to my other colleagues.
Yeah, you can proceed. There will be time when we allow our honorable members to make comments, questions, if any. You can go ahead.
Thank you, Honorable. Let me start perhaps by underscoring the fact that the Social Cash Transfer Program, the SCT program, as we know, has been implemented since 2003. And it really is a flagship program and one that demonstrates Zambia's commitment to reducing poverty but also vulnerability. The United Nations Children's Fund, UNICEF, that the three of us are representing today, have been supporting the government of the Republic of Zambia through the Ministry of Community Development and Social Services implement this program since the late 2000s. In 2016, UNICEF also supported an impact evaluation of the multiple categorical and child grant pilots of the SCT program. And this really informed the inclusive targeting model of the program that is being used today. UNICEF has and continues to work with MCDSS to support this program. Our key focus is on system strengthening. And by that I mean things like strengthening the data systems, the grievance management and mechanism, the case management support to beneficiaries, and all of these things are to help enhance the delivery of the actual social cash transfer. Currently, UNICEF has also convened a United Nations joint program on social protection, which supports the SCT and the wider implementation of the social protection policy, which includes contributions from other UN organizations such as the International Labour Organization, ILO, the United Nations Development Program, UNDP, as well as the World Food Program, WFP. Please allow us to provide responses to the questions raised in the memo on the following topics. The first one was on really the adequacy of the policy and legal framework governing the program. And perhaps if I am allowed to start with the legal framework. Let me first start by congratulating the government for having one of the most comprehensive and transformative social protection policies in the region. This can be, of course, further strengthened and made rights-based through a legal framework that governs the implementation of social protection programs. A process to develop a draft social protection bill was conducted multiple times, and yet we have not seen this bill being presented to Parliament. So this is perhaps one area that we would really like to support the government on. The National Development Plan. This was another query on the National Development Plan. We know that the 7th National Development Plan and now also the 8th National Development Plan puts poverty reduction as a key priority in the country's development agenda. The 7th NDP implementation plan was to cover 50% of the poor through social assistance, and this can safely be said to have been achieved with over 5 million people being reached through the SCT nationwide today. That's 973,000 households. In terms of policy, the SCT is governed by the National Social Protection Policy of 2014. The policy is currently being revised under the leadership of MCDSS with technical support from UNICEF. The 2014 policy has been successful in informing the scaling up of social assistance to the country, in laying groundwork for shock responsiveness of social protection programs, as well as their integration with other sectors. The integrated framework of basic social protection programs developed by the ministry in 2018 informs graduation and integration opportunities and resulted in the 2022 Cabinet Memorandum on Cash Plus. The Cash Plus agenda is important as it ensures complementarity amongst and across various social services. And perhaps I can use a recent example of a field visit that was conducted to Kafue to illustrate this point, where we were able to interact with women who were provided with combined benefits from multiple programs, especially both the social cash transfer and the food security pack. This was encouraging as the stabilization of the household was apparent. Asset accumulation was progressing. One of them even had as many as 50 ducks. Additional income was being generated from community gardening, and the children of the families attended school and accessed health services. This is just one example that demonstrates the complementarity between cash transfers and other social protection programs that really have a catalytic effect in terms of building resilience and promoting income generation at the household level. Despite these successes, we also know that challenges remain regarding the coverage of children and adolescents, especially during the first 1,000 days of life. That is a critical window of opportunity, which currently are not provided for under the SCT. To do this, UNICEF has been supporting the MCDSS in its efforts to address some of these gaps through pilot initiatives. Let me move on to the sustainability and the financing mechanisms of the program. We would like to address the issue of sustainability both from an ownership as well as a financial dimension. In terms of program sustainability and ownership, we know that there is strong ownership, and this is evidenced by the continuous expansion of the program by the government. The ongoing efforts to develop and strengthen the SCT to enhance both its effectiveness as well as its accountability, coupled with the fact that the government is continuously increasing budget allocations from its core resources, is noteworthy. In terms of financial sustainability of the program, there are, however, risks. While the government has continued to support this program with sizable allocations that have consistently increased over the years, we also know that there are sizable supplemental income or supplemental funds via concessional loans from the World Bank as well as grants from bilateral cooperating partners. There is therefore a continued need to strengthen the sustainable financing framework for the program for an event when the concessional loans or grants run out or come to an end. In terms of financing mechanisms and options, the current financing arrangements is such that the SCT is currently funded by the Government of Zambia through the Ministry of Finance and National Planning, as well as through the Multi-Donor Trust Fund through the World Bank. In terms of financing options, the SCT can be funded from treasury resources, but this will require them being ring-fenced or organized by earmarking specific revenue streams, such as, for example, taxes on alcohol and tobacco or levies on mobile network usage. I will now move on to the role of non-state actors in complementing the government's program. UNICEF and other UN agencies, as I mentioned before, through the United Nations Joint Program on Social Protection, are providing technical assistance to the implementation of the SCT program, as well as the wider social protection policy. With support from cooperating partners such as Ireland, the Kingdom of Sweden, the Swiss Confederation, and the United Kingdom of Great Britain and Northern Ireland, we have been able to contribute to strengthening the relevance, the effectiveness, the efficiency, sustainability and equitability of the SCT program as well as the wider social protection policy, including through making it more rights focused based. This has included activities on capacity building of ministry staff at central and local government levels. It has included strengthening the SCT delivery systems through initiatives on improving data management, grievance management, case management, as well as evidence generation and advocacy, and convening of partnerships, communication, community engagement, as well as civil society driven social accountability and integration with other social services to strengthen the humanitarian development nexus. Regarding the latter, in terms of strengthening this humanitarian development nexus, UNICEF has supported the MCDSS implement 2 emergency cash transfer programs to respond to the 2019 drought as well as the COVID-19 pandemic in 2020 and 2021. Let me move on now to the challenges faced in the implementation of this program. While there have been notable advancements under the SCT with progress in ensuring that payments are timely as well as predictable, and a system that is now enhanced in terms of a payment system through the Zambia Integrated Social Protection Information System, ZISPIS for short, we have seen that progress has been made in the targeting and grievance management of the program through ZISPIS, and the program currently covers 973,323 households across the 116 districts of Zambia. But we also know that there are remaining challenges. And with your permission, Honorable, I will now pass on to Daniel Kumitz, our Chief of Social Protection, to be able to give you a little bit more detail on the specific challenges that remain with regards to the implementation of this program.
Thank you.
Thank you so much, Malti. Honorable Committee, Honorable Chair, Honorable Members, thank you so much for this opportunity to look at the bigger picture of this amazing program. The social cash transfer program has a significant scale. It has been increasingly expanded over the years, and it is reaching so many people in Zambia. But one may wonder, how come that poverty numbers have not gone down further? We estimate in simulations that poverty would be higher by at least 3.6% point without this program. But at the end of the day, we really want to see a sustainable reduction of poverty and inequality numbers in the country. So what we have attempted to provide in our memorandum is to unpack this issue. What are the 5 things that can unlock this investment to sustainably reduce poverty in Zambia? And the 5 things are the transfer value, the reach of the program, the coverage, the need to preempt and respond to shocks and disasters, the need for sustainability in financing and staffing, and last but not least, maybe the most important of them all, to link the social assistance program with what we call graduation pathways. And my representative has given the example of the women in Kafur who were able to combine cash transfer benefits with community support, community gardening, food security pack, and this is now getting them out of poverty. Because rather than getting a transfer every 2 months that helps them to address the consumption needs of the household, but then month after month, it is like that is now the main income for a poor family. But by the combination of the different programs, they now have the cash transfer to stabilize the family. We know that in most cases, the amount is enough to put food on the table and bring children back to school and strengthen health services. But it is not enough to provide for basic needs and to address all the needs that may exist in a big family. But now bringing in the additional programs is bringing an income generation where the cash is like a floor to cushion the poverty impact. And then the other program, the economic empowerment program, are now the ones that are able to bring the beneficiaries into income-generating activities. And then if that is stabilized on a sustainable basis, where we know they will not come back to poverty, then that's where the point can be reached to say these people can now be weaned off from the program, because they now are able to earn their own income and provide for their own families. So in terms of recommendations, what are the 5 ways to, or the 5 opportunities that exist in the current policy and policy landscape, the economic situation, and the fiscal space to bring these 5 things together? If we look at the transfer values, the poverty line in Zambia is estimated at more than 800 kwacha per month, but we're giving the families 200 kwacha. So why are we doing that? Because we assume that maybe they already have something to get by, right? So they don't have nothing. But we know that if we, depending on where we go in the country, they don't have 600, right? But that would be needed so that the top up of the 200 brings them to 800, to the poverty line. But that is not the case. So we know the poverty depth is between 400 and 500 kwacha deep. So with the 200, we bring them up, but not to the poverty line. And then we have additional pressure from inflation, from the austerity measures that are being put in place, and economic problems. So we know that we need to have a higher transfer value to make a bigger dent on the poverty impact. Then secondly, on the coverage, we are already covering 50% of the poor population with the social cash transfer program. That is amazing. That is a coverage that exceeds many of our neighboring countries. But some of the priority categories are not yet included in the way the program targets. So my representative mentioned the first 1,000 days of life. Another category is the children in need of care and protection, as defined by the Children's Code Act that was passed by the Sixth Chamber in last year. These are categories where, if they are vulnerability, they are not yet easily included in the program because it is not in the coverage. And what we see in communities is if in the community we support half of the community but not the other half of the community, then ultimately we are diluting our impact. But bringing the coverage to the need of the entire community, that is what will mobilize, encourage, empower the entire community, and then further strengthen the impact on poverty reduction. So the expansion of the program beyond the 50%, all the way to hopefully an entire coverage of the population as is being discussed in the context of the 8 NDP, that would be highly recommended. Then we mentioned shock and disaster. So every time a shock comes, or a disaster like the floods that are now in multiple parts of the country, like COVID-19 2 years ago, drought conditions that exist year after year in different parts of the country, but also economic shocks when prices go up suddenly, or local market meal in some areas can go up to 200-300 kwacha a bag. In these cases, we are losing our investment, because we have been providing families with 200 kwacha month after month to get them to rebuild their asset, to get them out of deprivation. And then these kind of shocks come, and now they can't cope, and now they start borrowing. Maybe they have planted maize, they sell the maize to briefcase buyers before it has even been harvested. And then we are losing our impact faster than we are investing. And in order to address this, we need the social cash transfer to be shock responsive. And what that means is that the cash transfer needs to be flexible. When market prices go high in this time of the year in certain districts, then those districts need to increase transfer value. If we have a flooding condition in some districts, then those districts need to include additional beneficiaries for the period of the disaster, maybe for 6 months or for 9 months, to ensure that we don't have new people getting poor while we are trying to bring the other people out of poverty. In terms of graduation, we need to make the Cash Plus agenda that was adopted by the government last year more systematic. We need to build the systems where the government has a data system to understand which beneficiaries are now in which situations and can benefit from which combination of programs, so that it is not an arbitrary process where different communities or beneficiaries benefit, but a very systematic and deliberate process that makes the undertaking more efficient and more effective. And then finally, while all these ideas, as important as they are, require increased budget allocation. And this is maybe the most fundamental challenge that needs to be addressed. The government has been able to increase the allocation to the program tremendously over the past years, supported with World Bank financing through credit facility. The IMF program is also seeing the cash transfer as one of the main indicators, and additional funding that comes from bilateral partners. But government, as it is stabilizing the economy and improving the fiscal base situation, can plan ahead beyond the next 3 years, the next 5 years, the next 10 years, can plan ahead to look at what are the best ways to provide financing, domestic financing for this program. And I'm very optimistic that this is possible. Why am I optimistic? I'm optimistic because social protection, and definitely this program, is an investment. It is an investment that creates a multiplier impact in families.